My name's Emily Herring. I'm 18 years old and I'm from Lake Dallas, Texas. I was a middle school cheerleader, and then when I was in high school, I was on the drill team. To be a cheerleader and to be in dance, you need to be in shape. And you also have to be flexible, both physically and mentally. In 6th grade, they had a spine screening at my school. A few days after the screening, I got a letter sent home with me that explained that I had a rib hump.
We took her to her primary care doctor and had her checked out and said, you need to go see a specialist. And she recommended Dr. Lieberman.
It was noted pretty early that she was developing a scoliosis. She had a curve in her back.
When they showed us the x-rays, my first thought was, well, this can't be Emily. You know, it's gotta be somebody else.
My spine was in the shape of an S. It wasn't like everyone else's spine, which is just straight. Mine was curved.
His concern was that as fast as her spine was deteriorating, that it would in fact affect her internal organs.
When we saw her, we tried to take her through all the typical non-operative treatment modalities, but despite that, her curve was progressive. So for Emily, essentially what we need to do is take the spine apart, bone by bone, stack it up again, and hold it in place straight with rods and screws to generate a fusion. So I've got to get the shoulders level, I've got to get the hips level. This is where the science part of this comes in, a lot of preoperative planning to do this properly for them.
Emily Herring, first cartwheel after being released from restrictions from surgery. Beautiful.
She did really, really well. She was back doing everything. She's one of our poster childs. She's doing really good.
My back feels normal, which is good.
It turned out to be a complete success.
If I didn't have the surgery done, I know it would have affected my respiratory system, which could have affected me singing, and singing is my life. It's a passion I have. I am studying to become a music producer, so hopefully that works out and I become a music producer one day. After my surgery, Texas Health really helped me get my functionality back.
Texas Health Plano, they were super thorough and they genuinely cared about Emily. They actually looked her in the eyes and really discussed things with her and treated her as an adult, which we really appreciated because it was a very scary time for her. And I think that made her feel very much at ease. So they were great. They were fantastic.
I would recommend Dr. Lieberman to anyone that needs scoliosis surgery because he just made me feel so comfortable throughout the whole process. He never left any questions unanswered, and he did such a great job. I never imagined I'd feel this good after surgery.